Hello, and welcome to the Clinical Microbiology Laboratory at Hershey Medical Center. Over the next few minutes, you will observe the practices and activities of a clinical microbiology laboratory. The profession of clinical microbiology offers a number of exciting opportunities to pursue a career in laboratory medicine that bridges the gap between the basic sciences and the practice of medicine, often referred to as the bench to the bedside of patient care. The detection and identification of infectious disease begins with a sample from a patient being received by the laboratory. Here you observe the technologist processing the patient's sample using methods standardized for the clinical microbiology laboratory. As you observe these practices, it's important to know that a career in clinical microbiology is multifaceted and multidisciplinary. Clinical microbiology integrates fields of study such as microbiology, immunology, molecular biology, and pharmacology to ultimately influence patient care and public health. The exciting and emerging studies of the human microbiome, emerging infectious diseases, response to bioterrorism, and global health are examples of highly popular scientific fields that are influenced by clinical microbiology. Here you observe a microbiology technologist evaluating the growth after overnight incubation of the specimens processed the previous day. Clinical microbiologists are truly involved in real-life whodunit mysteries on a daily basis. The microbiologist pieces together the real-time unfolding of evidence for the presence of bacteria, viruses, fungi, and parasites that assist the clinician in the diagnosis and management of patients with infectious diseases. Clinical microbiologists most often work in hospitals, public health, or commercial reference laboratories in settings that range from urban to rural, private to public, academic to industry, or civilian to the uniformed services. The professional career fields that make up the laboratory staff include technicians with 2-year associate's degrees, technologists with 4-year bachelor's degrees, and doctoral level directors with specific postdoctoral training. You will observe here that in addition to manual procedures, the laboratory also relies on the use of automated equipment for the isolation and identification of microorganisms. In many instances, the clinical microbiologist uses automation to generate more rapid test results and reports. Clinical microbiologists are also educators and consultants. In this scene, a technologist trains pathology residents as part of their clinical pathology rotation. Doctoral level clinicians and scientists, both MDs and PhDs, undergo this type of bench level training as they become eligible to direct the clinical microbiology labs of the future. In this scene, the microbiology director is educating by leading a consultative session with the hospital infectious disease team. Here, the clinician first presents a synopsis of the patient's clinical history.
He came to our hospital because he'd actually fallen and sustained some knee injuries, but at the beginning there was really nothing to make of it.
Following the case history, the director projects a microscopic image so that the clinical team may review and discuss. Notice the interaction first with the senior or attending physician discussing his observations, followed by comments among the clinical team. As the discussion continues, the clinical team begins to discuss potential treatment strategies. This is a unique feature of clinical microbiology in that the results provided often lead to very specific therapeutic interventions in the clinical management of the patient. Additional interaction between the director and the team continues as the director orients the team members to the culture plates and discusses how the organisms are identified. Present are medical school students, PharmDs, medical residents, infectious disease fellows, the laboratory supervisor, and members of the laboratory staff. I hope this video has sparked your interest in clinical microbiology. There are a number of additional resources that more specifically describe the many educational paths that may lead to a fulfilling career in clinical microbiology. To find out more, please write down the link displayed.